Number 1, test item cluster for patients with mechanical neck pain most likely to benefit from thoracic manipulation. Symptoms lasting less than 30 days. No symptoms distal to the shoulder. Looking up doesn't aggravate the symptoms. Go ahead and look up for me. Thank you. An FABQ, physical activity score, less than 12. A decreased upper thoracic spine kyphosis. And then cervical extension range of motion, less than 30 degrees. Go ahead and look up for me. Thank you. Number 2, test item cluster for full thickness rotator cuff tear includes drop arm sign. Go ahead and bring your arm up. When I remove, please let it fall slowly. Thank you. Painful arc sign. Go ahead and raise your arm up all the way towards your ear. Thank you. And then the infraspinatus muscle test. Elbow at 90, take it to 40, stabilize, don't push in, resist, resist, resist. Test item cluster for subacromial impingement includes the same 2 tests as before as the infraspinatus muscle test and the painful arc sign, but it has the Hawkins-Kennedy test instead of the drop arm sign. So here, here, and then just pushing down. Test item cluster for mechanical neck pain that benefits from thrust manipulation to the cervical spine. Symptoms lasting longer than 38 days. Expectation that manipulation will help. Cervical rotation, range of motion difference between the 2 sides of 10 degrees or more. Go ahead and turn your head to the right. Okay, going back up. Go ahead and turn your head to the left. Thank you. Alright, and then go ahead and lay down with your face in the spot. Pain with PA testing of mid-cervical spine. Number 4, test item cluster for cervical radiculopathy includes cervical rotation less than 60 degrees to the affected side. In this case, we'll say his right side is the affected side. Go ahead and turn to the right, please. Thank you. We have Sperling's test as well, so adding compression and neutral. Go ahead and look up at the ceiling for me, please. Adding compression and extension. And then adding compression and rotate, or adding compression to rotation and extension to the unaffected side. And then adding compression and compression to extension and rotation to the affected side. We'll then do the median nerve tension test. So go ahead and lay down, looking up at the ceiling for me, please. Slide to the right a little bit. With depressing the scapula with my leg, we're going to extend the wrist, radial deviation, external rotation, and then we'll go right here. If there are no symptoms, they can go ahead and turn their head to the opposite side, or side bend their head to the opposite side, and do the test again. Also, there is distraction as well. If you can square up on the table, please. Number 5, the radial nerve tension test. Here, thumb in, flex here. Medial rotation, extension. If symptoms are reproduced, the test is a positive. But if they have minimum symptoms going through this basic form, you can go ahead and have them side bend their head away. Go ahead and side bend. Number 6, differential diagnosis between a rotator cuff tear and shoulder impingement versus C5 or C6 radiculopathy. For rotator cuff and shoulder impingement, you have supraspinatus or infraspinatus atrophy, decreased active range of motion, and external rotation and abduction. So active range of motion, and also lift your arms up to your side. Thank you. And you would also see weakness in those movements as well. And then you would see normal passive range of motion in these movements. So external rotation, and then abduction. You would also see tenderness, typically localized to the greater tuberosity, so acromial bursa, and then painful palpation of the biceps tendon due to inflammation. It can also be tested with the Hawkins-Kennedy. Here. the near test, going here in the scapular plane up towards the ear. And also, if I could have you stand up, the lift off. You go ahead here and don't, or push off, and don't let me push you back. Very good. Now for the differential diagnosis for the C5 or C6 radiculopathy, you would see a stiff neck, compensated movements with the neck as well. You also would see muscle guarding and an affected posture. You'd also see or observe loss of sensation in the C5 or C6 dermatomes, tenderness in the neck region, close to the spine where the nerve roots come out. And you'd also see reduced passive range of motion in any of the movements. And then C5, you'd see weakness in the C5 and C6 myotomes, so shoulder abduction. Go ahead and show that. Down. And then elbow flexion with wrist extension. Some of the tests we can use is compression, distraction, and then cervical rotation towards the affected side. Let's say in this case that his right side is the affected. Go ahead and turn to the right. And in the rotation, we're looking for anything below 60 degrees. Thank you. Number 7, moving valgus stress test of the elbow. Up here to the side, out here, fully flex, and then rotating with the valgus force out the elbow. Number 8, active compression test of O'Brien. You might hear straight forward, have thumb pointing down, stabilize, pressure at the elbow. Go ahead and flip over, palm up towards the ceiling, stabilize, pressure at the elbow. And then we also have the empty can test in the scapular plane, stabilize with a thumb down as if they were pouring out a glass of water, pressure at the elbow. All right? And number 10, the apprehension crank test for the anterior shoulder dislocation. Go ahead and lay it down, back to the side, rotation, and we're just going down.